Now, the Institute for Water and Wastewater Technology at DUT, or the Durban University of Technology, has revealed that the recent civil unrest in KZN has contributed to a substantial spike in COVID infections in that province. Let's speak to an expert on this. I'm joined from DUT by Professor Faizal Bux. Professor Bux, always a pleasure speaking to you. And it's no real surprise that we're seeing a slight increase in numbers because of that unrest. But just how bad is it? Good morning.
Good morning, Garrett, and thank you so much for the opportunity. So, I'm going to touch a bit on the results that we found recently. The unrest happened around between the 12th and the 17th of July. And post that, we noticed that around the 31st of July, the clinical case numbers had increased substantially. So before the unrest, the numbers of infections over one day was around 1,366. And post-unrest, around the 31st of July, the numbers had increased substantially to 2,239. Now, those were clinically confirmed cases. So the kind of work we do is we actually look at the wastewater. So an infected person generally passes or sheds the virus in the stool. And we found that before the unrest, the average copy numbers of the virus, the actual genes, was in the region of 2 million copies per 100 moles. But post-unrest, the numbers had jumped up to around 12 million copies per 100 moles, which was substantial, clearly indicating that the unrest certainly could be responsible for the large number of COVID-19 cases.
Professor, I mean, I don't have an awful amount of time with you, but just the number that you're giving, I think so many people have been wondering with those, and some were calling it super spreader events, weren't they? That kind of rioting and looting that we saw, that only now we're seeing the impact of that. I mean, it's almost double post the looting as well. What does this do for the healthcare system in that area as well, and also from a water treatment aspect? What concerns would you have as the director of that unit?
No, certainly. I mean, you know, far as water is concerned, I don't think water can be considered a medium for transmission of the disease. But the kind of work that we do, we are using wastewater as an indicator of the trajectory of the pandemic in the Durban and surrounding areas. So that's a very powerful tool that we're using. It's called wastewater-based epidemiology, where we actually get a real-time indication of the infection levels within the communities. Thanks.
And what is that when we look at the numbers that we're getting from the health department and the numbers that you're seeing, Prof, now that I've got maybe just an extra 30 seconds with you, you're looking at the actual numbers coming through from the wastewater. How close is the numbers between what you're doing and the Department of Health? Is there a big discrepancy?
Well, let's just say approximately clinical cases confirmation was around threefold increase post the civil unrest. Our results are showing approximately a sixfold increase post the unrest. So there is some correlation, but certainly ours is more a real-time indication of the level of infection in the community.
So this is giving us a real sense of actually what that unrest, particularly in KZN, had done. Prof, thank you so much. This is fascinating. Professor Faizal Bux from Department of University, from the Durban University of Technology. He's the director there of the wastewater department. So before COVID-19, listen to this, before the looting in KZN, daily infections tombs roughly 1,366, in just the days after the looting in KZN, same areas, 2,239. So if you were ever wondering what that looked like, super spreader events, it clearly was almost double since the looting, just in KZN.